Hi everyone, Dr. Jen here, talking about is your cycle normal or are you having common symptoms that seems to be normal because many people experience the same symptoms. This is in similar to headaches, right? We know that headaches are a response to how our body's functioning the best it can with what it has, but headaches are not normal. So, when it comes to your menstrual cycle, let's talk about what makes it normal or what is expected to be normal, what you can do if you realize now that you have an abnormal cycle, and the importance of having a normal cycle. So, let's flow. When it comes to a normal menstrual cycle, it should happen every 21 to 35 days. When it happens, it should last 3 to 5 days and it should start and it should stop. You shouldn't have some spotting before it really starts, and you shouldn't have spotting after when you think it should end. And it shouldn't be too heavy or too light. Heavy is one of the more consistent symptoms we hear about, where they're going through so many tampons that they can barely keep up. They're using a pad for backup because they're always bleeding through and things of that nature. And then the different symptoms that people associate with period, that doesn't mean that just because it's common is normal. Low back, breast tenderness, GI changes like constipation and diarrhea, having fatigue, mood swings, cravings, and that cramping that ranges in some degrees of just, yeah, you feel it, but it's not horrible. You're not taking medication all to the way to excruciating. They can't work or go to school because it's so extreme. All these are how our period should function. So we shouldn't have those symptoms. We should be able to start and stop. It should be, heavy to light. It should be in that range. And then it should happen every, like I said, the 21 to 35 days. Now, everyone doesn't follow the book. So when you find out you're normal, maybe you are, a little before, a little after. It's not necessarily this is what it should be, but there's the consistency in what your body does. But having a period every 60 days is not normal, or having, 2 periods within 20 days is not normal. So different things like that. There's, different variations. When it comes to now realizing you have an abnormal cycle, what do you do? So you've treated yourself throughout, what time you've had your cycle. You've either, and usually you're treating yourself by getting rid of the symptoms. So maybe use Midol or ibuprofen. You're using heating packs to try to, help with the cramping, but that just helps with the symptoms. So if that became unbearable, then a lot of women have moved to birth control. Birth control will give you fake hormones. It will basically get rid of your cycle, because even on the week that you have what we call our cycle, it's actually withdrawal bleeding. Basically, your withdrawal of those hormones is the cause of it, not an actual menstrual cycle like you have without being on birth control, which is what we call our normal cycle. So if you're trying to achieve an actual normal cycle without just chasing the symptoms, you first have to start with health. I know it's always the start, right? But really, if our body is functioning at a more optimal rate, our hormones are doing the things they need to be, and then our cycle can be normal, and you're starting and stopping, you're having it within that range, it's heavy and light, and you're not having those symptoms. So what we work on with women is making sure they're staying hydrated. We want to make sure their stress level is adaptable. We always have stress, but are you dealing with your stress? And then are you staying active, even going for walks or some kind of movement, yoga, whatever kind of movement, and definitely lighter intensity movement during your cycle. And how is your nutrition? Are you getting fruits, vegetables, protein, fat in? Those are essential. Chiropractic adjustments are important because it checks our nervous system. Your nervous system goes to your uterus, so it must be important, let alone our whole body depends on our nervous system. So that's crucial. And then it depends what menstrual products you're using. Are you using ingredients that actually irritate your body or are causing more bleeding? Because they can offset your hormones as well. So, we have the option of better quality pads and tampons. There's the cups, which are really nice because they tell you exactly how much you're bleeding and there's no question. You see the volume, you know, are you too heavy, too light? Are you right in that Goldilocks middle? And then the importance is you're doing all these things, but maybe things still aren't quite where they should be. And that's a little bit more on the supplementation aspect, because we can do all the things, but especially nutritional wise, our food is just not the same it used to be. And any abnormal signs of a period are usually signs of iodine deficiency. We talked about that in a few videos ago. So if you want more info on that, check that out. But that's really crucial too. Now, the also importance is on this journey of finding health, just because you started doing all the things and your next period isn't great, don't be upset or frustrated. It's a journey. It takes time. So, you know, it might not be the first or second period. It might be your fourth or fifth period before you start seeing changes. And also know if your third period, yeah, you had cramping, but it wasn't as intense as, you know, your first period, but that you had while making your changes, or think of the period you had prior to making these changes, then you're moving in the right directions. So you're starting to find that optimal health. Your hormones are starting to function and balancing the way that they should. And now you're starting to reach that aspect of a more normal cycle. But why is it important? Our cycles are important because what happens during our cycle is that inner lining of your uterus is shedded off. And then all that debris has to go somewhere. So it goes out the vagina, and that's what we have for our menstrual cycle. If that doesn't happen, can you imagine the buildup that would happen in our uterus, and how maybe things that shouldn't happen or diseases or issues with our uterus would happen down the road? So cleaning out our uterus, shedding that debris is important, just as important as having multiple bowel movements during the day, because that gives out the trash in our intestines. This is kind of taking out the trash inside our uterus. The other important factor is when we have a normal cycle. So we know now that a normal cycle means we're reaching that more optimal health. If you're a woman who is trying to have a child and you haven't achieved a normal cycle, well, that means even if you do get pregnant, that pregnancy might be a little tougher than had you reached that more optimal health. Now, we also know that it's not all on the women, it's based on the men too. So you guys can check out our preconception video as well. But when it comes to normal cycle, remember, whether you're 12 or in your 50s, that it's important to find that health so that your hormones can balance and function at a better rate, and therefore have a normal cycle. And it's important to educate our younger girls, because we kind of learn a little bit in school about our cycles, but not really that these symptoms don't have to happen. And so if we can start making changes for our younger generation, it can only make huger changes for our future generations. So if you have any questions on what we talked about, just reach out. Thanks. Bye.